Well, the STS organized a session on tricuspid regurgitation, and we believe it is very timely. It's not on a specific study, but it is on the management of tricuspid regurgitation. And there were several talks, but globally, if we look at tricuspid regurgitation, it is currently a big problem. The magnitude of the problem starts with the epidemiology of tricuspid regurgitation, because if we look at the prevalence in the population and we calculate for the US, there are approximately 1.6 million people that are carriers of moderate or severe tricuspid regurgitation. And that makes, if you calculate the incidence, around 200,000 people every year who have a new diagnosis of moderate or severe tricuspid regurgitation. What we had learned in the previous in the old literature is that tricuspid regurgitation, particularly associated with mitral valve disease, doesn't warrant a great attention, and we have to treat the mitral valve and leave the tricuspid on its own, and that it would get better. And so for the past 60 years and more, we have been very negligent of tricuspid regurgitation, hoping that treating the mitral would treat the tricuspid regurgitation. And there has been an accumulation of data showing that this is not the case, that tricuspid regurgitation persists and that it has consequences. But first, if we go back to the epidemiology of that mass of people who have tricuspid regurgitation,